Good morning, everyone. Thank you for having us here. We're really excited to share the development of this wonderful program that is available in the South Florida area. So my name is Nancy Torres. Who I am, right? Well, I'm many things, right? I'm part of my family, mother of a teenager with a disability, and as you can guess, that changed my path, the path that I was building, and it created a new journey for not only for me, but of course for my family. My background is in psychology, and 7-8 years ago, I had the wonderful invitation to create this program from scratch. And 8 years later, we have a wonderful team, and we are very proud of the work that we are doing with families, for families living with disabilities. So I'm going to let Paulina and Teronna introduce themselves.
Good morning, everyone. My name is Paulina Wolff. I'm also the mother of two boys that are under the spectrum of autism. So I started navigating the system by myself and gathering a lot of experience and knowledge. I ended up participating in the program, being part of it, getting more knowledge, and now sharing the experience and the way to navigate through other families as well. I've been with the program officially 2 years, but again, I've been doing it out of the field as a personal experience for so long. I'm a business administrator, but I'm also I'm on my pathway to complete the psychology degree. So because of life took me there basically. So it's been a beautiful experience and a road, and I'm happy to be here sharing with you as well.
Hi, my name is Teronna Maddox. I'm with the Family Navigator Program with the University. Can y'all hear me? Is this better? Hi, my name is Teronna Maddox. I'm with the Family Navigator Program with the University of Miami. I've been with UM about 10 years now. Just freshly joined the Family Navigator side. I was on the side with dealing with insurance and not so much with the families telling them no. So now that I'm on the other side of the medical field to be able to give them the resources that they need, I also have an uncle that I was the caretaker of. I have a nephew and a cousin on the autism spectrum side. So being able to be that voice for them when no one else was there is so heartwarming and good now. So yeah, that's it.
Perfect, thank you, Paulina and Teronna. So let me start talking a little bit about the University of Miami, because of course, not everyone lives in the wonderful and hot Florida. The University of Miami is a large medical system, very important in the area, and it's located in a huge medical campus where also another health system is located, the Jackson, that is the safety net for many people living in the area. Also, we have the Miller School of Medicine as a part of the University of Miami. And specifically, we have one building that is called the Melman Center for Child Development. As the name says, under this building, we have several programs and clinics that are serving children with disabilities and other kind of needs. So that's the context where this program is functioning, right? So let's start. We are going to go through different important parts of our history and the components of the program, what we do, how we do it, what is the kind of population that we serve, and we are going to end talking about what are the key factors that have made this program successful and efficient. And of course, we are going to share some of the current projects that we have. If you have any comment or question, you're welcome to do it during our conversation, but also at the end, we will have a specific time for a Q&A. Thank you so much. So the main goal of this program is to support health equity for families living with disabilities, mental health concerns, behavioral issues, and special healthcare needs. So as you can see, we cover a broad array of population, right? Thank God we are not tied to legal definitions of disabilities, and really we serve families where any parent or family member have any kind of concern regarding the well-being of the children, okay? So that's very important. This program was created at the end of 2015 as part of some changes that the strategic plan had at that moment. And they decided to identifying the needs of the families and the gaps of the services that were currently available at that moment, they decided that some kind of navigation program will be beneficial for families. And of course, they were right. So the main goal of our program is to bridge the communication, the connection between the different systems that families living with disabilities or mental health concerns and any other chronic medical condition face when they are trying to access services, right? So we are the bridge between the medical system, of course, the clinical system and the school system, and the social services system. So that's the main goal that we have. And how we do it? I'm sorry, I forgot to mention that this program is funded by the TAF Foundation that is located in New York, the headquarters, and they fund several disability projects and initiatives, basically in Florida and also in New York. So how we support health equity for families living with disabilities? We do it in two main ways. The first way is we provide direct services for those families living with disabilities in our clinical setting at this building that is called the Mellman Center for Child Development. So through the years, we have worked solid partnerships with a large number of programs and specific programs and clinics available at the University of Miami and the Jackson Healthcare System, so they refer families to us. Families also can find out about our program by themselves, right? The information of our program is available in a website. Mouth to mouth, right? Maybe a family member tells a neighbor, why not? I tried this program and they helped me. You can call them directly. And also, I would say that 20% of our referrals come from the equally strong partnerships that we have with other community agencies. Because, as you know, in this area, there is no way that just one agency or one program can serve 100% of the needs of a family. So that's one way when we provide direct services to the families that are referred to us. And the other way is very soon in the beginning, I will say that maybe 1.5 years after we start functioning, we realized that our capacity is limited. We are a very small team. This is the team. Well, there is some backup team, but they are only part-time, right? Maybe 10%, 50% dedicated to the program. So, and our founders were very clear from the beginning that they didn't want to hire a big number of family navigators. So we got creative and say, okay, so what else can we do? And we developed a completely web-based training, disability training, to build capacity on those community agencies or other clinical settings that are in need of the knowledge and expertise of how to navigate disability services, mental health services, medical services. So those are the two main ways that we support health equity. And I'm going to let Paulina provide more details for the first one.
Okay, so like being one of the family navigators, I deal directly with the family. So we start with conversations. They have like a safe environment for them to provide all the information. We follow the HIPAA protocol, so all the information is confidential, so the family can disclose whatever they are looking for or if they receive that recommendation. So we focus on them, wherever they are. If the family doesn't disclose the situation specifically, but they say, listen, I just need these services, can you help me with that? We go with them. If they tell you the whole situation and there is a crisis, we go with them, step by step. We provide that peer support, and also I have my personal experience, so I've been able to relate with so many mothers and parents dealing with the same situations, so they feel more confident in telling you the whole story. So we have conversations about the educational component. We can talk about what is the school system, what can they provide, or what are they missing, or what are they in need of. They provide linkage to services, but it's not only like a list of phone numbers for the family to reach out. We kind of drive them to the point where they can access those, because it's not easy and the systems are huge and complex. So we kind of help them to get there, to get the information that they need or the services that they're looking for. We also provide to our clinical social worker that part of, and this is kind of new because of the huge demand of mental health lately. So we kind of provide that intervention, short intervention, support for the families when they are in crisis and they need kind of put everything like in balance for them to be able to think and reach out to those services. Because when you are in crisis, you cannot really think well. So we offer that kind of support as well, so the family can move to reach out to the services that they need and according to their priorities. We may have conversations of any type. So we can talk about therapy intervention. If somebody needs therapy, what kind of therapy, what kind of health insurance do you have, who work with you, who can work with you, where are you located, all those kind of details are included in the intake process. We can also talk about social services. Right now in Miami, there is a huge demand, and I'm pretty sure that here in other places as well, for housing. So we have to recognize where the housing providers' resources are, where after COVID, the emergency program relief, so where they are, what are they doing, where they can meet the families. School accommodations, we talk about the IPs, the special accommodations for school, if they need an extra help or an intervention at school. We talk about, of course, the medical coverage, because a lot of people are coming to Miami, they don't have documents, they don't have identification, they don't have insurance. So how are they addressing that, and how can we provide those kind of services? We connect them to legal aid for the same reason, because a lot of people are coming with those needs. And we talk about immigration services as well. So we cover like basically anything, like we becoming whatever the family needs. So if we don't know, we research and we drive it, and we support them until we get there. I always tell them that we're gonna find someone that is gonna be able to help us. I mean, I don't know where, but we kind of do that. So this is one example of our families. We had a family of a mother of two boys, 14 and 12. Both they had the diagnosis of autism. So this family is facing several challenges: eviction, lack of transportation, health insurance requirements, difficulty finding therapy providers, and school issues. The father is not involved in the picture. The mother is lost her job because she was always receiving constant calls from schools due to their son's behaviors. So we start this conversation. We ask them, the mother, okay, what do you want to do? There are so many things involved, but we kind of help them like, okay, what is your priority? And let's get from there. So mother was very proactive, and she wanted to cooperate and find the resources for her son. So what did we do? Okay, so we started with eviction, so we connect them with the legal services of Greater Miami. for the eviction process, because they need a letter and it's a whole process for them to stop it and to be able to find a place before they get out. We connect them to the City of Miami neighborhood offices. These are local resources, but just for you to have an idea, like what kind of support we find where, and then we kind of bring the family to them. And the Advocacy Network on Disabilities is another big agency that also provides services for people with disabilities. And the Laros House is a big shelter that is also building a new facility for people without a place to live. We also spoke about transportation, so the special transportation services. And we spoke about health insurance because both of the kids needed ABA therapy. So, and it's been more common, so what kind of insurance and programs can work with them? We connected them with them. And we also got in contact with Parent to Parent, which is one of the big agencies specialized in education. So they provide professional services, educational specialists to these families to understand what are the rights of their kids and what they can get access to.
And sorry, here I would like to add that this is an explanation of how we support this family. Illustrates how, in how extent we are bridging the family with the different services available. And we are going to talk at the end that one of the successful components of our program is that we keep a constant conversation and a presence at the community level, right? We cannot help families if we don't know how APD is working, if we don't know who is running the federal funded parent center for that family, or what is happening with Medicaid changes, right? So grand part of our work is to keep updated about what is happening in this large universe of mental and medical and disability services, so we can transfer, we can digest the information, because sometimes it's so complex, and transfer that information and share that information with the families that we are serving. Of course, we are not experts, we are not lawyers, we don't provide diagnosis, right? If family asks, do you think that my child has XXX? We cannot answer the question, but in the way that we can help you is we will connect you based on your zip code, your insurance, or the lack of insurance with the organization and the agency that can provide that answer to you.
Okay, and Nancy already mentioned that, Teronna wants to share another example of one of our families.
I had the pleasure of meeting a family who mom really was going through it. Son turned 18, and as you know, when you turn 18, guardianship is in place. Son is 18 and competent, cannot give mom the power of attorney that she needs in order to provide the services that he's going to need, whether it's taking him to the doctor or taking him to school, because 18 is technically in South Florida, they're considered to be an adult. So with getting guardianship, she had to pay a lot of money to get the guardianship, and the guardianship is only for 1 year. Every year you have to renew it. So I would have the ability to provide her not only the IEP, which she needed because she was having problems with the school with transportation, and not everyone can afford the transportation that we offer, the TSA transportation, because again, that's money out their pocket that they have to pay for. When he's in public school, and he can be riding the school bus, mom wasn't aware that they didn't implement that in the IEP, so they can pick him up from the home, take him to the school, vice versa. So by me providing that information to her, she was able to get transportation for him. I didn't have any luck in guardianship because, again, as Nancy and Paulina said, it's hard. So with my connection and knowing someone that's an actual lawyer, she agreed to work with the families to help them to get guardianship at a decent rate, because of course she's not pro bono, but I delivered a story to her in an organization that we're doing at the University of Miami, so she was willing to set her fees to the side and come with a better rate than someone going out to spend $5,000 every year just to be over your own child that you gave birth to. So after I successfully closed the case with her, I was able to go back 2 weeks later and provide that resource to her. So it's not like we close a case with a family and we don't have any more dealings with them. Any new information that we get, if it's pertaining to any particular family, we're gonna still reach out to that family and provide the resources that we have now found out for them.
And I will say there that the beauty of our program is that we are huge advocates for, because this information shouldn't be a privilege, and you cannot be punished for having more difficulties and more needs in the healthcare system than anyone else, and or that because we share with other families. But so it doesn't have to be a privilege, and we should be able to spread the word more, and that's why we are here, and that's why we go several places teaching and telling families you have rights, you can have access to the resources. There are places that can offer help, and we're here to show them that and to share that with them.
But and a lot of schools don't know, parents don't know that when they do have an IEP in place for their kids that have disabilities in the school system, because a lot of schools call and say, oh, you need to come pick your child up, oh, we can't do this, we can't do that. And that's why Nancy, as Nancy mentioned, Parent to Parent is one of those organizations that give the parents knowledge on what a school, what Miami-Dade County Public Schools and Broward can do and can't do. So, and that's one, like, don't always call a parent if you can't, if a child for IEP.
Question.
One question.
I'm sorry. What does IEP stand for?
Individual Educational Plan.
Thank you.
So that is so let me just explain briefly to you. It's a very specific plan with a child has a disability or any condition. He has the right to have an evaluation at the school, and it's going to be provided by an interdisciplinary group. So then, after that results, the child is going to have with several recommendations. So, okay, the child benefits from this kind of therapy intervention during the day, through the week. Some goals are going to be determined, and then the plan is going to be followed every year. And the family has the right to have a translator if they don't have a translator. The family has a right to have a person that advocates for them if they don't understand their rights. And every year the goals change because the child grows up. So that plan goes to the child until the end of the high school, right? And it has to be followed. In theory, it has to be followed. So it's a lot of part of the parent to push for those things to be followed through.
So it's individual.
Educational plan. It's just those specific needs for that child in the school setting.
And it can be for like dyslexia, it can be for
Anything.
autism.
Whatever
so
is
it
written
can be-
there is like the law, it's a contract. So it has to be followed properly.
Thank you.
And in the event when the IEP is not followed, does that get addressed by the ADA?
No, the ADA, you have to do that.
Well, there are different steps that parents can follow when the IEP is not being followed, right? And that's, if that is happening with a family, we will connect the family with one of the parent centers that have more expertise on that. But basically the suggestion always is the first level of communication with the teacher, with the school administrator, and if that is not working, the case can be escalated to the district level. And if that is not working, well, you can hire a lawyer to sue the school district.
And there are legal
But there are some
services
steps established to manage those situations.
for that. Any other question?
This is a general federal law.
Oh yeah, this is a
Okay.
federal
Yeah,
law,
yes.
based on IDEA.
Don't worry, no, that's
So
why.
that's why I'm here.
That's why, exactly.
Yeah.
So another question regarding that, I have a neighbor who has a child with special needs, and his IEP went till age 23. Okay.
Usually 22.
22.
22.
Okay.
Yeah.
Yeah, it follows the child from the moment that they enter into the school system to when they graduate. It becomes a little, it has different stages, and it becomes a little harder for when they are growing up. But they're still valid, and that's why the role of the parent or the caregiver is very important for being following up and making sure that those things are being met, those needs are being met.
And And if the IEP cannot be followed in that school district, then the school district has to pay to assist
Yes.
with getting schooling elsewhere.
Yes,
So-
that's what the law says. It's a little bit difficult.
Again,
It's
it's
weird.
weird.
It's
Yes,
hard.
exactly.
But it can happen. My neighbor's son had very extensive needs, was blind, and they couldn't get the needs met at the local school in California. So they paid for him to go to
Another county or another
Berkeley
place.
School
Yes.
in Boston.
Yes.
Yeah, well, Boston is one of the top states that provides better services for
Especially.
children with special
Where
needs.
is-
Unfortunately, Florida
Boston.
is at the bottom.
Oh,
Okay.
God, they have you.
Yeah.
You have to. You guys sound like you completely, I'm a retired director of health, medical management. And so I dealt with the social services and the care coordination, all that was for me. And obviously, anything clinical, anything with medical, there's always a social component to health. And you guys seem to have covered all of the psychosocial, mental, physical,
We
emotional,
try.
legal areas. Is there any area that you won't go into? Like, well, I don't know. I
No,
don't
if
know.
there is-
Can't even think of one.
No, actually we've been expanding and learning
Okay.
and adapting because the needs have been changing after COVID. So we
Yeah.
see a lot of high demand on mental health services.
Okay.
So what we do, we learn, we research, we adapt, we speak with other providers. That's kind of our role.
So you really have no, like, formal
No.
boundaries? You're just-
No.
For providing services.
Yeah. Okay.
No.
Very impressive.
Okay. This is kind of the statistics. Since we started serving 142 families. You see, it's a small team, but now we are. This number in 2023 is up to March, so we are already in 142, more than that number. And what we do, we kind of manage the data for the connection to the services. So we collect the data of the success, which has been between 70 and 80%. Again, we work with the family, but it's up to them to make the final call, right? So we help them through the end, but at the end, family was too busy or something else happened. So that's kind of the situation. We also provide a survey at the end of the process. So immediately after the family has been served, so they can rate the quality of the services and the performance of the Family Navigator. This is for you to have an idea. We live in Miami, so we have a very diverse population, and we cover the lifespan. By the way, our services are totally free, and we are highly connected with the Department of Pediatrics. So most of our population comes from families with children between 6 to 12 years old, which is the school age. Then we have a big portion from 3 to 8, ages birth to 2, then the 13 to 20, and 21 and up. So that's kind of the proportion, the distribution of the age groups that we serve. We also, most of the population that we are serving is Hispanic and Latino. Then we have Black African American, then white non-Hispanic, and other which can be Asian, Indian, and okay. And that reflects on the language that the family, because one of the questions is, what language do you prefer to be served? Some people feel more comfortable speaking English, some people feel more comfortable speaking Spanish, some people do not speak English at all. So depending on what they say, that's when we are able to provide that okay, either in Spanish or in English, we can help the family.
Spanish, English, Creole.
And Creole as well. For that, we have to access more resources, but we still do.
And also we are able to use the University of Miami translation services in case that we have a family that speak, I don't know, Russian or Chinese or any other language that where any of staff, it's fluent.
quickly through the barriers because we are short in time, but these are the barriers that we have found, and basically the reasons why maybe providing the services sometimes are difficult. So we've seen that the barrier that we find most is the lack of knowledge of how the system works. So that is the main barrier. Then we see that difficulty in finding quality medical therapy providers, then the lack of options, because we can help them, but we cannot. Miracles are not like that fast. So if there are not so many resources, of course that is another barrier. The language, as we already explained, sometimes the parents have a very demanding schedule, or they are single, or they're very young, or documentation. The low socioeconomic status, it's another barrier. Mistrust of services or systems. Having special needs demand a lot of special care. So they have an experience, and they are afraid of looking at research and reaching out for another one. Low level of education sometimes, and the parents being young or single, it's another barrier. And this is just a brief recap of the families that we already told you. We have had families from Russia, from Turkey, from anywhere that you can imagine. Like most of the countries, as we know it, we have families from there.
And our demographics show that our program is serving a good representation of the population that lives in the South Florida area, which is important because we want to be inclusive and we want to reach out to the real population that is in need of services. So now moving into the second modality that we support health equity for families living with disabilities is building capacity in the communities that are around the University of Miami. So the main goals of this training, and really it's more than a training, it's partnership that we create with community agencies or clinical settings. We stay with them an average of 3 months. Not only having access to the training, but also having coaching sessions. So the main goal of this program is first, as you can imagine, there are many people working in the disability field that really have not been exposed or trained about what is the best perspective to serve these families. So we completely believe that disability is more than a health outcome. Disabilities is a culture and it's a way of living, and much more than that. So that's what we try to transmit and try to inspire people to see disabilities in a different perspective, right? And it's not only about taking a medicine or getting X test or X treatment, but it's also how they can help families to live a better life, with a better quality of life, and how they can support inclusion, right? A meaningful inclusion. So that's one of the goals of this training. The other one is, of course, increase their knowledge and expertise on how to navigate disability services. So the same expertise that we have, the same knowledge, to transmit that to them so they can serve directly their own families that are living their own needs, because depending on the neighborhood, of course, the needs are going to be different. And the last goal is to help these community agencies to expand their networking. So if they haven't heard about, for example, Parent to Parent of Miami, Family Network Disabilities, Legal Aid, Disability Rights Florida, if they haven't, we will explain how these agencies can help the specific agency. And if they are interested, because we know people there, we can do, again, the bridge between them and representative of these agencies. And now when we are not in the picture anymore, they can have direct contact with these agencies and they can refer families to these agencies. So in that way, we are increasing the benefits of this navigation program. So this training is completely web-based. When we started in 2018, it was in person. We very fast realized that it was not going to work. It's very difficult to have, many different members of one organization being physically present at the same time, at the same moment. So even before COVID, we were thinking about creating a web-based training. Then COVID came, so that was the last push to finally do the transition from in-person to a completely 100% web-based program. Is self-paced because the participants will access whenever they have time. We are training nurses, we are training social workers, and of course they are full with their own responsibilities from the work. So it could be that maybe 1 week they only have 20 minutes. For one could be on Monday morning, for other one it could be Tuesday afternoon. That's not a problem. Of course, we set a timeline, right? And usually it's 3 months to complete the training and the coaching sessions. And we have worked very hard to make this training interactive, dynamic, and we have targeted different learning styles, right? So we have 6 different modules. 6 different modules. One is understanding disabilities, the second one is disability and healthcare systems, when we see the intersection between disability and healthcare, and we share a lot of data that for many people can be surprising, right? Then culture and community in disability care, and I'm sure that you have heard the term culture and community. It has been there for many years, but in the past 2-3 years, it has been more well known. Family navigation, the family navigation model, the different disability services available, and how to do community engagement. And these are some outcomes from the community agencies that have been trained. I'm just going to mention one, that is the connection, the successful connection with resources that is higher of the ones that we have. And this is based because usually these community providers have a more long-term relationship with their families, so that's why it's better. So now let's go to why our program is successful. So one main component is having in the team people that have life experience, because we understand, we have walked the walk, we know what it means to be fighting for to be connected with different services. And not only that, we also have we bring our own reputation and our own networking, right? I have been navigating the system for 15 years, so I have my own personal connections with Early Steps, with Channel Fund, and with many other organizations. And I am bringing, Paulina and Teronna, we are bringing these connections to the program, right? So sometimes we know an answer, not because we are participating in community coalitions. We know the answer because we have used the same system and the same service. Can you go back, please? The other one is meeting families where they are, and I think Paulina mentioned that very well. For some families, it can be just sharing information and they are ready to go to call and do what they have to do. For other families, it's more hand over hand, and we can stay with the families for, if it's needed, for 5 months. We have address barriers as they present. I have mentioned that we have strong partnerships within the University of Miami and also in the community where we are. And we have a very inclusive and diverse advisory committee that is composed by self-advocates. We have adults with disabilities, faculty members, community representatives, parents, siblings of individuals, and this committee provides, they provide feedback. We present to them, they provide feedback, and they provide suggestions. Of course, vision and commitment from the leadership team. We cannot do that if, in the Bellman and the University of Miami, the leadership is not involved. Funding is a crucial component to sustain this kind of program because all our services are completely free. We don't generate 1 cent. We are all expenses, right? So we need somebody to sustain our program. Accountability. We are always presenting results, solid results. We have a solid data system where students from the medical field and from the public health field help us with that because we don't have the expertise to process grand amounts of data, so they help us with that. We have been published, and that has allowed us to present in different venues, local and national wise. And I would say flexibility and adaptation to whatever is happening. COVID, of course, it was a great example. The needs of the families changed immediately when COVID hit, and people stopped asking questions about clinical services, and they wanted to know about financial support, rental aid, and how to apply to unemployment benefits, because that was the situation that we were living. These are the current projects. I think we only have like 2 minutes left. So I will say that now we are planning to do a survey in a national level to identify other navigation programs with similar goals and to see if we can come with information about what are the common things and in what kind of things we are different, right? So we can have do a benchmarking. So what is working and what is not is working, and we can learn from each other. And also we have another project that is to develop a series of parent videos to provide emotional support to parents living with disabilities or mental health concerns. That is also on the way. The time flies. I thought we were going to have enough time to provide more details, but now I would like to open the floor if you have any question or comment for us.
Must be me again. Question. So you said you're totally funded by the TEF Foundation?
By the TEF Foundation.
So are they providing the funds when you go pick up someone and take a driver somewhere? Is it a budgeted amount?
No, we don't provide transportation services. If they
refer
need
them.
that, we
Refer them.
connect them with the agency that
So you're
provides
basically a
transportation
referral
service.
service to go into
Provide
all these other
resources.
networks.
Like primary, that is the primary, the meaning that
I don't know where to go, so I
Yes.
go to you.
Exactly.
Now, how do I know to go to you?
It's
You
through
spread the word.
Referrals.
right?
Who's gonna refer me?
Yes, you can do your own research and find us, and you can call us, self-referral. 80% of our referrals come within the University of Miami and the Jackson system, right? Pediatricians are doing the referral to us, neurologists, the genetic clinic, many physicians, and 20% come from outside UM. Parent to parent can refer families to us, right? Disability Rights Florida can refer families to us. Maybe if we train a daycare center, right? Maybe the daycare center also can refer families to us. So
We
that's
found a
the
lot of
proportion.
families just doing the research, how to do this, and we come up on the website as an option. So we receive also those referrals.
And what is your website?
You can Google University of Miami Family Navigator Program, and we will show over there. Any other questions? Yeah.
So two, with the referrals, are you all connected with the schools in the sense of whether it's special services or the counselors,
We do that.
school counselors?
We do that.
So they are aware of you.
We can guide the family if they don't know that the school where they are attending has a counselor. We will help the family to identify the counselor and maybe to write an email with the family CC, and if the family doesn't speak English, or if the family doesn't know how to write this email, doesn't know what to ask, what to say, we will help the family to do that. Or also we can connect to one of the 2 parent centers available in Florida.
Can parents outside the Miami area access your 2?
Yes, we serve.
We have families outside.
Yeah, we serve 4 different counties.
I'm talking
Monroe.
You mean like
California,
a different
Montana.
state?
Oh, well, we have families that call from other states, but usually those families are interested in moving to Florida. So they want to know what is happening in Florida, right? I am going to be able to keep the benefits that I receiving here in California. We have plenty of those calls during COVID. Many people from California moving to Florida, right? Because of the rent and the price of the houses. And when we explain that Florida doesn't take the amount of taxes that you pay in California, and so the number of services available are much less. But yes, we can take calls from families living out of Florida to explain what is happening in Florida. If a family from California calls us to know where I can get free swimming classes for my child with Down syndrome, I won't be able to answer that question, but we'll say, let me help you to identify the parent center in the county where you live, and they will help you with that.
That was gonna be my next question.
Web-based training?
Sorry?
Part of your Can they, so if I live in Georgia and you have your web-based training, can I, as a resident of Georgia, go on and take your web-based training?
The resources are gonna change.
Yes.
No, the web-based training. No, we are when it comes to the training, we are focused now in Miami-Dade, and we are just expanding to Broward. So we plan to expand little by little, but what is the problem? Why somebody from Georgia cannot take that training? Because we don't have information about the specific services that are available in Georgia.
Understand that, but the content.
So
So the
like mental
content
health service.
would be the same.
Same.
Yeah,
but
would be the same.
What
The
is an
resource that I go
IEP?
to.
Oh,
would be
yes.
different.
You have
But
as
I
a
wanna
center.
come for your content. So as that, can I come for your content knowing that the resources that you talk about will not be the ones that I have?
We can talk about that and maybe create a partnership where you put if you have the information about the services, the local information, we can provide the general content.
Because part of that is knowing each state has
Their
the
own
similar
services.
things, right? But it's knowing, the number one thing that you said was knowledge of systems.
How to
What's the
maneuver
through the
biggest
system,
issue?
yes.
So there was a young lady over here who had a question.
What happens to, maybe you mentioned it, what happens to the individuals who age out of these programs?
It's
Do
no
you refer
age.
them?
Well, we cover the lifespan, so we cover from childhood to adulthood. But of course, when people do that transition, the number of services, federal, state, and local services available for people 18, 21 or up decrease significantly. Yeah.
Can you talk about the process? So with the Yellow family, you mentioned of all the resources and the areas that they got connected. It was either 8 or 10,
Yeah.
somewhere in there, right? So so I'm the mom. Do you give me the information and then it's up for me to call, or do you call?
Depending on what you
How
want.
does that-
Because I'm gonna ask you, okay, do you feel like you wanna do it? If the family is in crisis and mom is overwhelmed, she says, no, can you please do it for me? I'll go ahead and do it for her. Then I get the appointment, I get the conversation with the other person, with the end of the need, and then I'm gonna say, Mom, we need to set up a time so we can meet all together. Then we have that meeting, so the mom can get connected, like driven directly to the hands of the agency or the service that she's looking for. And sometimes mom said, yes, okay, just give me the information, I'll go through that. That's why we do a follow-up process, and we stay with the family for, with families for a very long time. We have a policy period, but we don't really set up the limitations on timing because everybody has a different schedules and
That's part of our
that's
flexibility.
exactly.
And
So-
as we mentioned, for some families, you just provide information and they are ready to go, they can handle it. But for other families, because of the barriers that they face, they will need more hand over hand. So sometimes we have to call insurance and make the questions. There are some phones that you cannot make unless the person is there. So maybe we do a three-way call. So, sometimes we do translation, right? Somebody's speaking English and we're doing the translation into Spanish. And sometimes we help families to do applications online. We do some meetings and we say, okay, let me share the screen. So are you seeing this? This is what you have to write. Sometimes it's not only translation, sometimes families don't understand the questions in an application form. What it means that my child is having behavioral issues. What does it mean? Well, what does it mean is 1, 2, 3. Have you observed that in your child? Yes, no, okay, so that's what you have to write. So depending on the need of the family, the profile of the family, the strengths and the barriers, that will be the amount of help or the intensity of help that we provide to them. And that's part of our one successful factor, that is we adapt to what the family needs. It's not what we want. Of course, we have a manual, we have policies and procedures, but we are flexible with that.
Yeah. I mean, in my case, I'm on campus 1 day out of the week. So some cases where I meet the family don't know what to do, I will actually walk with them to whatever coverage they need. Maybe they need Medicaid. Jackson is a facility that offers Medicaid to families. So I will walk them to the office, sit down with them if I have to, help the family apply or see what issues they're having. If I have another family that says, oh, I can't get an appointment, I've been trying so hard to get into the University of Miami, no one's answering the phone. So I'm there on campus, I'm gonna walk to that office to communicate with someone to get that family that appointment. And my success is 100% because I'm gonna get them in there. So.
and I want just to add that another key factor that is the foundation is humanity. Yeah. We really care about these families. Teronna has helped families to get some shoes.
Yeah.
Paulina has been, doing applications maybe at 7 p.m. at night because that's the time that the family. If I ask the University of Miami, Paulina should be working at 7 p.m., they are going to say, no way, Paulina cannot work at 7 p.m., but I know she's working at 7 p.m. I have visited families in the Jackson that has been hospitalized in the clinic. That's not part of my job description. Yes. But if it's a family that I'm serving, and it's as across my office, I will go and visit them. What do you need? Do you need? Sometimes we have to pay for food for these families.
And it's not even about the family that needed the shoes. She wasn't even like one of our clients or anything like that. It was just I was in the right place at the wrong time, and the mom was walking. She had some heels. Walking a newborn baby, 1 month old. She didn't have the baby strapped down in the car seat, the stroller, and she walked, her heel twist. Mom came down, baby fell out, hit the concrete, the ground in the hospital. So I just was like, I thought I had some shoes for her, but I didn't. But I was able to walk the campus to find someone, physical therapy was able to provide a pair of shoes for her. And then she wasn't one of our families. It was just, oh no, I can't let you continue to walk like this, like we're pushing the stroller. And she was so thankful, crying, but she was at the same time, she was overwhelmed on everything that she was going through that day. So,
do you guys do interviews for webinars or YouTube or podcasts?
We're expanding to that. That's one of the projects we are.
Okay. We would like to. But really, we are full what we are doing right now, but we would love to. The closest that we are doing is creating this series of cabin videos. But for sometimes you need more funding for that, so you need to go to your funders and ask authorization, you know how that works.
One last question. Are there any other questions? I have one more. And then we'll be at time. Sorry. This is a passion of mine, but I am a parent of a child with significant disabilities as well. And so the family navigation makes a huge difference. For not only for the child, but for the family as well. So no one in the room has asked, but I know you're wanting to know. If you wanted to bring a program like this to your area, how does the Family Navigator program get started?
How do you get it started? That's a good question.
We do research. I have a because she just moved to Texas. She told me, well, what am I gonna do? I said, okay.
No, but how is the Family Navigator Program started?
Started.
It was, well, first you need to leadership team involved and have it as in their vision, right? And then you need to find the right team.
You can have some advice from Parkland because they have a very good model that is working in Dallas, and they
if you
basically
have a family advisory committee or a patient family
You
advisory
can
committee,
share.
will help.
they're doing good.
But you need to get involved people with life experience. And I have to say, sorry, I'm not going to sound modest. I was in the right place in the right time. I was very involved as a parent looking for resources for my child. And I was in the right time and the right moment. They knew, they respect my reputation, and they offered me the job. And they say, we think that you can create this program. And I did it. We created, of course in the beginning it was only me, but then other people, other team members joined. And after 8 years, this is what we have created. But you need to have the right team. If not, one person cannot do too much. Thank you so much.